I've heard many people say, I certainly don't feel as old as I look. But time and gravity have a way of showing on our faces. And there are ways to slow that ticking clock. And if you're not ready for surgery, there are other less invasive options that might work for you. Joining me with more is Dr. Timothy Treece with Columbus Aesthetic and Plastic Surgery. Doctor, nice to have you here.
It's nice to be here, Gail.
The market of injectables and things has grown tremendously. So I dare ask what's new, because I'm sure there is something that's new.
There are a lot of new things. I'll tell you about a couple of products, but I'll just say, when we talk about facial rejuvenation, one component is that as we get older, we lose volume in our faces. And there are several different ways to restore volume, and these products are one of those ways. The nice thing is they're very safe products. They last up to 2 years. Some of them might last at 2 years or just a little bit more.
That's longer than I thought.
And that's pretty darn good. But these are all naturally occurring chemicals, but they occur in our bodies and all animals' bodies. They're glycoproteins, and they don't have a lot of allergic phenomenon, and we don't have issues with people rejecting them or having any medical issues from them. So it's a very safe way to add a little volume to our faces, as unfortunately our faces deflate when we get older, but that's part of what we help people with.
Where do you put most of the time injectables in the face to increase that volume? Well,
the most common place I put them are in the parentheses. We lose, as our faces age, we have a little inframedial descent of our cheek fat pads, and we lose volume around our mouths. And when we do that, there's sort of a fault line right there, which is the nasolabial folds. So I put volume here, and I also put volume on the edges of people's lips without making their lips huge.
And that's kind of the thing, I suppose. People want to look like themselves, only a little better.
Right. There's a beauty to elegant understatement, not making too much volume or having lips look ridiculously huge and out of balance with the rest of the face is part of the art of what we do.
There's something called fat grafting that you told me about that I've never heard about before.
Right.
What is that?
Well, the nice thing is, one way we can add volume is to borrow a little from somewhere else in the body. We do a lot of liposuction. The beauty is, if carefully done, taking some fat from maybe your tummy or your hips and putting just a little bit judiciously in certain areas of the face is phenomenal. It can be done in the office under local anesthesia, and a portion of that fat graft takes and lasts forever, just like a skin graft would take after a burn.
Because it's part of your original makeup, DNA and all that?
Right, it's your own tissue. And it actually gets some blood vessel growth into it, and it becomes a part of your new face.
Wow.
Yeah.
So that is better than anything that would be artificial if you are having something else done, and it can be doable.
Right. It's a little more intensive because you do have to have a little bit of a surgical procedure to remove the fat through a very small cannula. For example, I take a lot of fat out from around people's belly buttons with about a 3mm incision. We pull some out. We actually spin it and put it in syringes, and then very carefully re-inject it to where you may need some volume.
Wow, so many new things. What age are people coming to you and asking for things like this, doctor?
I see people in their early 30s regularly, right on up to my age and beyond. But I'd say early 30s, we start to see little fine lines, a little volume change, and we're very sensitive in our society about the aging process.
You mentioned that some of these injectables last 2 years. I was always under the impression it was a couple months and you had to get more. Are they improved products, new products, or are these different than, say, a Botox, and so they last longer?
Yeah, these are different than a Botox. Most of these are based on an ingredient called hyaluronic acid, which is, as I said before, a naturally occurring glycoprotein. This product is a little different. This is basically, it's called L-polygalactic acid, but this has been used as a suture material for years and years, this basic ingredient. And they've made it into a gel that's much like the absorbable sutures that we use, but it lasts for about 2 years. And so we add a little more volume to people with this, and we get a little longer result. So this product that's called Sculptra has been a great benefit. And then the brand new item that's sort of the hot ticket right now is called Voluma, and it's a variation of this other hyaluronic acid, and it has body to it. So we can actually use this product like a chin implant or a cheek implant to add a little volume in a space where we may want more projection. And this has been a nice adjunct to our other techniques.
Well, you know what? Come back again soon, because I know when you come back you'll have something new that you can share with us.
Probably so.
Thanks, Dr. Treece. Nice to see you.
Thanks, Gail.